positivity. It's Lindsay Ray, the body image activist. I'm so excited to be back again. And this time I have a very special guest with me, nurse practitioner Mary.
Eventually, I was in my early 20s when my cousin was diagnosed with brain cancer at 32. Glioblastoma. She passed away by the time she was 35. And her whole journey is actually what inspired me to get into healthcare. At the end of her life, she was in hospice, and her hospice nurse relief never came, so she abandoned her patient. And that day, I decided that no person should ever have a nurse like that.
That's what happened to me when I gave birth to my daughter. After my surgery, I was left in the bed for 12 hours, sitting in my own blood. My ex couldn't get them to come in. Finally, my mom, I had to, a 25-year-old at the time, had to get my mom to go out and yell at the nurses to come in. And then even then, they decided to bring in training nurses, which was fine. And I know everybody needs practice. I was already in a state of shock and trauma, and when they couldn't get the IV, they kept asking for one more chance and one more chance and one more chance because they were training, and I was in a state of trauma and shock and unable to advocate for myself. When is the point where we need to know how to self-advocate for us to make sure that we don't become another statistic? Almost 40% of women with heart attacks aren't diagnosed until after they've passed away. And that's because women present in a completely different way than men do. And that's part of the problem that we're having in the medical industry, is that we're looking at women and men the same rather than differently. As a feminist, I want equality, and I want to be viewed the same as a man, but also differently because I do have a different anatomy. When we think about heart attacks, or when we think about strokes, which I think are some of the more common signs, things that'll happen that can lead to death, what are symptoms that you think women specifically need to look out for? And when do they need to push for more help from a doctor?
So I think heart attacks are unique between men and women because men have very specific symptoms, whereas women, our symptoms of a heart attack are very vague. We also tolerate pain and tolerate a lot before we will seek out medical attention. Sometimes the vague symptoms can not even really be self-recognized that something's off. We sometimes have pain in our right or in our left arms. Most female patients who experience a heart attack and survived report they just felt off. They didn't feel themselves. Women's intuition, we are blessed with that. Always focus and pay attention to that because that will save your life someday.
What are a couple of things that women can ask for if they go into the hospital and they're feeling off? But what type of testing should we be asking for? Because ladies, we need to advocate for ourselves. This is about advocating for yourself. It's about knowing what to look for and when to be concerned and when to push for testing.
Strokes and aneurysms kind of have similar function where patients complain of thunderclap headache, the worst headache of your life. And we will get the imaging that you need.
And what about for the pain in our arm or the feeling off? What should we ask for in that?
EKG, troponin levels, they can test.
When is the point in time we have to say, you know what, our health comes before our finance? What are those specific symptoms where you need to get yourself not to a doctor's office, but to an ER right away?
If it's a stroke, you have facial droopiness, asymmetry is not there. You're stumbling for words, word finding difficulty. Just pay attention to your body, and when you know something feels off, or don't be afraid to seek medical attention. They cannot refuse to care for you.
Don't be afraid to ask for a second opinion. If the doctor that you're seeing isn't listening, isn't ordering the diagnostic test, because that's really step one. If you don't diagnose, you can't treat. So my advice to you is advocate for a diagnosis and don't stop advocating until you get one. Well, thank you, Power of Positivity, and I hope to be back soon. And Mary, keep doing what you're doing because you are literally saving my life. Awesome. Thanks, guys.